Well, it has been a big week in the pandemic, both in our state and for the entire nation, the world, really. I mean, just within the last few days, more kids became eligible for Pfizer's vaccine. The CDC says if you are fully vaccinated, you don't need a mask anymore. And here in our state, all counties will enter phase 3 next week. The governor hopes to reopen everything by the end of June. Now, this morning, I'm joined by State Secretary of Health, Umair Shah, to talk about all of this. Dr. Shah, good morning to you. Thanks for joining us. We appreciate it.
Thanks for having me. Hope you're well today.
Doing much better now with the news. I mean, this is what we wanted to hear. So Governor Inslee says that we will be adopting these new CDC guidelines about wearing masks. We'll start there. So when do you expect to see businesses adopt this new CDC guidelines? Like when we go to the store, when can we ditch the mask?
Well, one thing that the governor said yesterday is that individually the businesses can still make decisions based on what their needs are, what their requirements are, and we're certainly going to support that. But at the end of the day, I think the message yesterday was that vaccines work, right? So vaccines work, they're safe, they're effective. And the key message was that if you are fully vaccinated, I'm still going to walk around with my mask, but you can be safe and feel comfortable not to have your mask on indoors or outdoors. And that's really the great message. Now, of course, there were a few exceptions, public transport and in a hospital and other kinds of settings. But for the most part, this is great news. And this is another reason why people should not hesitate and they should get vaccinated.
Okay, yeah, absolutely. So we know that these looser mask mandates are for people who are fully vaccinated. How do you stop folks from just lying about it?
Well, first of all, you can't. I mean, we hope people don't try to game the system. But remember, if somebody goes in without a mask, they're not vaccinated. They're at risk. They are not protected. They actually can get COVID-19. They can get sick and they can get hospitalized. So we hope people do the right thing. And it's not really about the mask as much now. It's doing the right thing by getting vaccinated. So we hope people do that.
Okay, so do you think we will get to that point where 70% of qualified people are vaccinated, especially with the reports that you and I have talked about saying that the U.S. likely will not reach herd immunity?
Well, we hope so. 70% is what, the governor said yesterday. June 30th, we're going to be reopened. But look, we're at 57% of our eligible population having at least one dose of vaccine. And we're trying to go another 13% to get to 70. And we can even open sooner than June 30th. I'm hoping, as Washingtonians, we always try to beat those goals and not just meet them. I'm hoping we can make it. So, fingers crossed. But it's going to be up to all of us to get vaccinated. Not just if you've gotten vaccinated, your job is done. Help somebody else get vaccinated. Talk to somebody else. Do everything you can to encourage others to get vaccinated too.
Yeah, the greater good principle there. So the Department of Health has new guidance for schools welcoming kids back to campus. Will vaccinated kids have to wear masks in the classroom? What do you predict there? What do you recommend?
Well, the thing right now is, as you can imagine, if you go back several months, CDC kept evolving the guidance because we didn't have as much experience with masks and we didn't have enough people that were vaccinated as well. So now at the same time, as we now look into the future, when you have more teachers and you have more students that are vaccinated, that's when masks requirements can start to get loosened. But right now, we're not there. We don't have enough kids. As you know, it's only for 12 to 15-year-olds. And certainly, we still have teachers that need to get, or other adults in the setting to get vaccinated. So there's a lot that goes into this. But ultimately, if we have vaccination across the board, then yeah, those mask requirements can start to move down. But that's down the road. Right now, we got to focus on getting kids and adults that are eligible vaccinated.
As I mentioned to you off the top, I mean, this is great news. Seeing, Seahawks tickets for sale and things like that. Concert dates are coming up. We're seeing concert series, ramping back up, which is really, really exciting. So these tickets are on sale. People are buying them. What about a crowded venue? Could we pack, T-Mobile Park at some point this season for the Mariners? Could we get in an indoor venue and see a crowded rock concert soon?
Well, the capacity requirements that still go in play are really very much dependent on vaccination, right? If we get those vaccine rates up, then absolutely we've got the ability to start increasing capacity. But I think the key message is that when we do not have enough vaccination happening, or we don't have enough people that are vaccinated, now you start to put people at risk. So this is trying to balance we want to, obviously there are, there are some stadiums that are saying we're going to have vaccination only sections. That's going to keep those individuals protected. They don't have to wear their mask. But then you're going to have other places where you just don't know. That's why the key message is let's all get vaccinated. Let's do what we can to really robustly reopen the state as quickly as possible and to protect ourselves.
Dr. Shah, we have 30 seconds left. What would you say to parents that are fully vaccinated but have kids too young to get a shot? I mean, how are they supposed to go about mask wearing?
Well, first of all, it's coming soon, right? I mean, the predictions are that by September, October, in the fall, that even younger kids are going to be able to get vaccinated as well. And we hope, fingers crossed, that's going to happen. But really, what we're saying and what we tell our kids is, look, wear your masks and do everything. Have your hand sanitized. Do all those things. You're protected, the adult, but make sure you continue to protect your child.
Dr. Umair Shah, we always appreciate your time. Thanks for joining us.
Thanks for having me.